Hey gang, it's Dr. Dodini from Calibrate ADHD. I was asked the other day about whether somebody can outgrow ADHD or get new ADHD, like as an adult. There's a lot of misinformation out there. ADHD is what it is. It's a neurological condition. You have it from birth, essentially, and you don't outgrow it. It's your brain, and your brain has some strengths and some weaknesses, and like all of us, we just have to learn how to work well with our brains. But I wanted to just dispel the idea that ADHD doesn't get worse with age. It doesn't improve with age. Our circumstances change. So it's possible that you were born with ADHD and you were bright, had a high IQ, you had a good work ethic, you were willing to work hard, and nobody identified the ADHD. You never got assessed, never got tested. You did well through school because you had the ability to do well through school. There were certain circumstances and structures and organization to it. You learned the life hacks of how to do well in school. And as you transition into adulthood, it gets a little more dicey. There's a lot of variability and a lot more distraction, frankly, in our adult lives. And we're more tired. Let's be honest. If you've been an ADHDer over-functioning for most of your life, using all of your coping strategies, you're probably pretty tired. So the assumption that the ADHD got worse is a little faulty. It didn't. You're more tired. Life is more complex and more complicated and a little less structured. And it feels like we're getting a new ADHD diagnosis or our ADHD is getting worse with age. The reality is life has its ebbs and flows, times that are easier, times that are harder. Our challenge with ADHD is to learn how to use our tools most effectively to adapt to those changing environments and those times when life is just happening. So the next time you are pondering on whether or not you have ADHD, even though you didn't get diagnosed as a kid, and maybe somebody told you, wow, you can't really get diagnosed as an adult, it's a childhood thing. That's just not the case. It's not true. You can get diagnosed. We can understand exactly what kind of ADHD you have, the severity of symptoms, and we can develop a personalized approach to helping you thrive with your ADHD brain. Just reach out to us. We're at calibrateadhd.com. Happy to have you part of our community and love to reach out to you and work with you.